Good morning. Good Monday morning. I want to say that a lot of mornings are feeling like Monday mornings lately, but anyways, here we are. Thank you again to Jay Gates for being here to interpret for those that are hearing impaired in our community. As always, we're going to start with the numbers. I talked to the health commissioner this morning. We've got a significant increase here today in the numbers. The positive cases in Hamilton County are 319. Remember, on Friday, we reported those positive cases at 178. So that delta is 141 cases who have tested positive. I did ask him whether or not that was an increase in testing results coming back, or is that an increase in people that are testing positive? And it's a little bit of both. Some of the private labs, as you know, are taking a little bit longer to get test results back. The governor has now responded and reacted to that. So this number is a mix of more positives and more test results coming back. So again, 319 positives in Hamilton County as of this morning. 61 of those individuals are hospitalized, and I regret to say that we are up to 7 deaths in Hamilton County. If you go on Public Health's website, you will see that they are breaking that down by way of zip code. They're trying to update those numbers once a week. City of Cincinnati looks very light colored because the data is not plugged in because they're a different health system, but we are working with the city to try to get those numbers plugged in so it's a more fair representation of what's going on countywide. Springdale and Norwood are also entities that have their own health departments, and so again, we're trying to work with them to make sure that that graphic that you see is as accurate as possible. These stark numbers are a stark reminder that we can't let our guard down. This next month is going to be critical in flattening the curve in Hamilton County. And I know I've said this before, but it really is time to double down on our efforts. Wash your hands, wash your hands, wash your hands. Stay home if you can. And if you need to go out for essential purposes, please practice social distancing. If you have to make a trip outside, try to consolidate those trips so that you're not leaving the home more often than you need to. And before you go out, ask yourself, is it worth it? So this morning we're going to talk about a situation that we've been dealing with, ever since this started, really. We're going to talk about the homeless community in Hamilton County and issues for renters that especially have become rather emergent since the beginning of the month. So Kevin Finn is here. He's the Executive Director of Strategies to End Homelessness, which will discuss details about homelessness. And Nick DiNardo is the Managing Attorney for Legal Aid, and he will talk about the Renter Assistance Program. We've been working with public health officials and the shelters to come up with a strategy to assist homeless shelters to achieve safe distancing in those shelters. To achieve this, I'm announcing today that the county administrator will propose a $1.1 million allocation to go to Strategies to End Homelessness for shelters to place high-risk individuals and families in hotels. And again, to achieve this safe distancing that we need in the shelters. This will reduce the population in the shelters and allow for better distancing inside the shelter, as well as provide a safe place for the high-risk individuals to ride out the stay-at-home order. So what we're proposing, and the vote will be, to be clear, the vote will happen on Thursday at the county commission meeting. Right now it is a recommendation of the administrator, but that 1.1 million, we've calculated out the number of individuals and families that need to be moved, and so they will be moved for around 45 days, trying to ride out the stay-at-home order, anticipating it might go a little bit longer than what we have in place right now. And so that dollar amount matches that number plus that amount of time. So that's the math that we're doing. 50% of the money will come from an increase to the county's CDBG Emergency Solutions Grant, and the other 50% will come from the county's allocation under the recently passed federal stimulus legislation. This approach represents advice from the public health community, our health commissioner in particular, to reduce the population at shelters based on risk factors. After we talk about that, and Kevin will come forward, we're going to talk about some confusion related to rents and evictions. And I'm going to let Nick expound a little bit on this. But in general, I think from what we know from the calls and emails that we're getting in the office, people are a little confused about what happened through the governor's order. So I'm going to be as clear as I can be and then let Nick take it from there. But what happened was there was a legal moratorium for evictions for commercial properties. That does not, though, extend to residential properties. And Nick, you'll correct me if I'm wrong, but that's our understanding of the governor's order. That said, in Hamilton County, municipal court is not meeting, and that's where evictions typically happen. And so the courts, because they're not open for business, those evictions are not moving forward at this time in Hamilton County. However, once those courts start moving again and start opening again, folks that have not paid their rent are at risk of being evicted. And so Nick and Legal Aid and Strategies to End Homelessness are working on a strategy for those renters to provide some relief. And Nick, I know you'll go into more detail, and I'm very grateful for that. So I'm going to leave it there. I've got a couple of things to announce. I'm going to leave that to the end. So I think we're going to have Kevin Finn come forward first to talk about the situation with the homeless community, and then have Kevin and Nick tag team about the rent assistance.
Thank you very much, Commissioner. Again, my name is Kevin Finn. I'm the president of Strategies to End Homelessness. We coordinate services for the homeless here in Hamilton County. I think our homeless shelter operators in Hamilton County have been very responsible in that they look for ways to proactively address the virus inevitably coming to Hamilton County, and decided that the best way to act as a homeless services system was to proactively deconcentrate the shelters before the virus actually arrived. And that has looked different in a couple different contexts. First of all, the family shelters are largely congregate, and there really wouldn't be a way to achieve appropriate social distancing in a family shelter setting where you have kids running around and that sort of thing. So what the family shelters decided was best for them to do is empty their congregate facilities and provide each family with a motel room where they could have a separate and distinct space for their family. So that action has been taken over the last couple weeks. Not all of the family shelter capacity was congregate, so there are some apartment settings that did not need to be relocated in any way. But the family shelters, Bethany House, Salvation Army, Interfaith Hospitality Network, and the YWCA of Greater Cincinnati proactively took the step to get families out of congregate facilities and into hotel motel rooms. In terms of shelters for single individuals, that has looked a little bit different. There are a lot more numbers. About 2/3 of our homeless population is made up of single individuals. So the number of rooms needed would be considerably larger. So what the single shelters have largely done is moved to deconcentrate their facilities so that they could achieve appropriate social distancing. They have been very strategic in targeting people who are elderly, sick, who would be most likely to become severely ill if they contracted the virus, and those are the people that they have determined to move out of their shelters and into hotel motel rooms. So most of the single shelters are still up and running in their normal facilities, though with a deconcentrated number of people within those facilities, whereas the family shelters have largely relocated into hotel and motel rooms. I think it is very appropriate to say a couple thank yous. First of all, these arrangements have been in place, or been put in place over the last couple weeks, and the first funder to step forward and say they would put money on the table to help make this happen immediately was the United Way of Greater Cincinnati and the Greater Cincinnati Foundation. The work of actually getting people out into the hotels and motels has been accomplished by the shelter operators, but with a great deal of assistance from the Greater Cincinnati Homeless Coalition. And then in addition to the commissioners, Joy Pearson and Jeff Aludo here at the county have been very helpful, as has Kelly Carr at the city of Cincinnati. So that is the work that is going on right now in terms of trying to prepare for the virus to arrive. We have not yet had a case in one of the homeless shelters. The city of Cincinnati has also been very proactive in setting up an isolation and quarantine facility that is available for people. It has two sections, where people can be isolated while they are awaiting their test results, and another section where people would then go if they do in fact test positive for the virus. To date, we've had several people go through the isolation portion awaiting test results. We have not had anybody from the shelters test positive and need to go into the separate quarantine space. There are 30 beds available in that building, but the city is actively planning to potentially open another building for that purpose should additional capacity be needed. So that is where we're at this point, and when we're done, I'd be happy to take any questions.
Before Nick comes up, I do want to, Kevin, you highlighted, and I'm grateful that United Way, the city of Cincinnati, the county, we're all in this together, and we're trying to figure out how to collectively address the issue related to the homeless population. So thank you for highlighting that. So next, Nick DiNardo is going to come up and talk about evictions and assistance.
Good morning. My name is Nick DiNardo, and I'm the managing attorney for the Housing and Consumer Practice Group at the Legal Aid Society of Greater Cincinnati. Currently speaking, there is no statewide moratorium on residential evictions. At this time, each court in each county can decide how they want to proceed with evictions. Now, in Hamilton County, there's been a total stoppage of all eviction hearings until mid-April. And as far as we know, that order is probably going to be renewed for another 30 days. And so there won't be any eviction hearings until mid-May at the earliest. That being said, tenants still have a duty to pay their rent. So if you're able to pay the March rent, you should do that. If you're unable to pay the March rent, we encourage you to contact your landlord and try and make arrangements so that some kind of a payment plan can be reached. There is currently limited funding from both the federal government and the state of Ohio to help people pay their rent, but we don't have enough money in place at this time to cover all of the need we're going to have. So it's important to talk to your landlords, and as soon as more funds become available, those can be used through the different sources of emergency funding to cover rents. If you're in subsidized housing, all subsidized housing evictions have been, there's a moratorium on those for the next 120 days. So if you're in subsidized housing, it's key for you to report any loss of income to your landlord so that your share of the income can be reduced, and there will be no evictions from subsidized housing over the next 120 days. For foreclosures, there are also, there's no complete stop of foreclosures at this time. The local Hamilton County courts have a 30-day moratorium, which we suspect will be suspended for another 30 days, but you should be in contact either with the court or with your attorney if you're facing a foreclosure at this time. Again, there are some resources available for emergency assistance, but those are limited, and so we encourage you to stay in contact with your lender and stay in contact with the courts if you're facing foreclosure. One thing that we would bring up is there was a executive order from the governor last week. This applied only to evictions and foreclosures of commercial properties. It did not apply to residential evictions. Frankly, there should be a moratorium on residential evictions. If they can do it for commercial evictions and foreclosures, they can do it for residential. So we would encourage the state to take statewide action so we don't sort of have this hodgepodge of different courts dealing with evictions differently. But at this time, that does not apply to residential evictions. The last thing we would say is if you're in counties other than Hamilton County and you have a question about this, you should contact the court whose name was on the summons that you received for any eviction hearings, any foreclosures, or any other civil matters. You'll have to contact the local court to find out if and when your hearing has been rescheduled. The last thing I would say is that utilities, all disconnects for both water and for gas and electric have been suspended. And if you're, for non-payment of rent, for non-payment of the utility bill. If your utilities were disconnected in the past couple of weeks or months due to non-payment, you may also be eligible to have those restored. So in terms of the water, if you have having an issue, call Cincinnati Water Works. They've been very good about dealing with disconnects and restoring service and stopping any disconnects that were scheduled. If you're having a problem with gas or electric, you should get in contact with Duke Energy, let them know what your current situation is, and they should also be postponing any disconnects and restoring any service that was recently disconnected. We're in the process with Strategies to End Homelessness and other local organizations to try and find additional sources for rental assistance, and hopefully there'll be more money coming both from the federal government and from the state government to provide that assistance in the near future.
Thank you. So, yeah, I think we're trying to understand what level of assistance can be provided for those that have lost their jobs and are having a difficult time paying their rent. And I know there are many people in our community that are very worried about this issue. So thank you for the information, and we will update that as we learn more about any assistance that becomes available. One other thing kind of in this space, we announced last week, Tim McCartney was here from JFS, which is Jobs and Family Services, and we talked about the PRC program, and I'm going to read through this real quick. Last Friday, we announced that people making 200% of poverty or less are eligible for $500 checks through the PRC program. This represents added capacity for the PRC program. And I want to say that, I get asked, well, what's 200% of poverty? And to give you that kind of a snapshot of that, for a family of four, that is a family of four making $52,400. That is 200% of poverty. So you can extrapolate from there. So that hotline is open as of this morning. You can get there either by way of the website, hcjfs.org, or you can call 946-1120. Again, 946-1120. I will tell you that as of this morning, and it just opened this morning, there are over 1,200 applications. So if you qualify, please make that call so that you get in the queue for that assistance. So with that, Bridget, I think we're going to open up for questions.
Thanks, Commissioner. Right now we have a question from John London with WLWT for President Finn.
Kevin, it's John London. Would you go over again, I didn't zero in on what you were saying about that, I forget it all, about where the homeless would be quarantined if they are tested positive, and then additionally for homeless who are on the streets, where do they go to sanitize? Where are the restrooms other than the one per park that's available in the city? Where would they self-quarantine?
John, if I understood your question correctly, one part of the question was about people who are outside and where can they go to sanitize and access facilities. I missed the first part of the question, though.
Well, I wanted to see if you would go over once again where the homeless.
In terms of the quarantine facility that I mentioned before, the city of Cincinnati has made one of the recreation centers available to serve as a quarantine facility. It's essentially two facilities in one. There are 15 beds for people awaiting their test results and another 15 beds for people that have tested positive for the virus. The city, so that's 30 beds that is available. Kelly Carr at the city has indicated that if the demand becomes such that additional beds are needed, that they would look at the possibility of opening another rec center to do something similar in a second location. And all the arrangements are in place for securing the supplies that would be needed to do the same in another rec center. They just haven't pulled the trigger on doing it yet because of the fact that the demand just isn't there yet, but they are ready to do that. I should not in any way give the impression that we have dotted every I and crossed every T in terms of the homeless services system being prepared in every way to deal with this crisis. We're sort of coming at it in a phased approach. Deconcentrating the family shelters and getting families into their own space was sort of step one. Getting the people who are most vulnerable to the virus out of the single shelters has been step two. And in answer to your question, John, I would say that the thing we're most actively working on now is arrangements for people who are still sleeping unsheltered. The issues like sanitation stations, places where people could go to sanitize, those are still in the works at this point. I think it's important to note that about 93% of our homeless population in Hamilton County resides in shelters, which is why we focused on the shelters first. And now we're working on making those arrangements for exactly the kind of facilities you mentioned, specifically for that about 7% of the homeless population that are sleeping outside unsheltered. So I could provide more details on that as it becomes available, but unfortunately we don't have all of those just yet.
Just a quick follow-up, Kevin, if I might. How do you see changing the way shelters operate in the future and the importance, greater effort to serve end up on the street?
I'm going to offer a little sort of system-wide perspective on what the shelters struggle with. First, in terms of what the effect might be on them going forward. My organization, Strategies to End Homelessness, administers about $25 million a year in funding from the federal, state, county, and city government. All of that funding, $25 million related to homelessness. The total amount of money that goes into operations of homeless shelters out of that $25 million is less than 2.5%, less than 10%. Homeless shelters are extremely under-resourced on a normal day. They are barely getting by from a funding perspective on a normal day. And the reason why we had to take the steps we did to deconcentrate the shelters is because the accommodations are so sparse and so compact, and people are sleeping so close together and sharing so few bathrooms and things like that, that there was just absolutely no way to prepare for this virus in a shelter. So in answer to your question, I think it's important first to understand how under-resourced the shelters are on a day-to-day basis. So my answer to your question would be, unless there are new resources that come available, I'm not sure that the shelters really have the ability to change how they operate going forward because they are so limited already. They're already doing the best they can with the resources they have available.
Next up, we have James Pilcher with Local 12, and this question is for you, Mr. Finn.
Good morning, Kevin. How are you today? Backing up real quick, you given some broad numbers in terms of percentages. How many actual people are we talking about in Hamilton County alone, homeless individuals and families?
Per night or year?
Either one or both.
On any given night in Hamilton County, we have about 750 to 800 people who are on the street or in a shelter. So when I say homeless, that's sort of very specifically what I mean is people who are unsheltered on the streets or are sleeping in one of our shelters. So it's important to keep in mind that that 750 to 800 does not include people who might be doubled up, sleeping on a friend's couch or without their own place to sleep, that sort of thing. It's much harder to count people in those sorts of situations. In a year, we typically have about 7,000 to 7,100 unduplicated people. So the homeless population turns over about 9 or 10 times in the course of a year. So a little over 7,000 in a year, about 750 to 800 on any given night.
Okay. So how far do you think this $1 million from the county is going to go? I talked to one organization that's already burned through $90,000 in a span of 2 weeks, putting up 100 to 130 people and families in hotels. How long do you think that's going to last? And as a follow-up to that, what hotels are you going to use? Because there's a concern that some of these organizations are sending some of their clients to other states when other states are saying don't travel into our state. We have an issue in Florence, for example. So, where are you gonna put them? I guess is what hotels are you gonna use?
So most of the funding for homeless services is geographic in nature. So most of the shelter operators that we're speaking with are operating exclusively in Hamilton County. So I know the organization you're referring to, Maslow's Army, I believe, they do operate on both sides of the river. But for the other shelter operators, they are operating exclusively in Hamilton County at this point, and they are using hotels that are in Hamilton County. In terms of which hotels, I'm going to decline to actually name which hotels, but I do think it's important to know for it to truly be an isolation for the family. It was very important that we focused our efforts on getting hotels that have at least a kitchenette in them so that families and single individuals both would have the ability to do some basic meal prep and that sort of thing in their room, because if they were having to leave to go out to other places to get food, that was potentially going to defeat the purpose of having provided them with their own separate space to occupy while we work our way through the pandemic.
How can organizations like Maslow's or Shelter House or some of these others that have been privately funded all this time get to this public money? Can they apply? How does that process work?
We have 7 shelter operators operating 9 facilities in Hamilton County year-round who always receive these funds. The Federal Emergency Solutions Grant funding that Commissioner Dreihaus mentioned just before, the county and the city of Cincinnati both receive an annual allocation of those dollars every year, which helps support shelter operations, which can, even under normal circumstances, can include the occasional hotel-motel rooms for people who cannot be accommodated in congregate facilities for one reason or another. Obviously, we're doing more of that now. So these are dollars that are not unknown to the shelter operators, to most of them at least already, but the county has received an additional allocation of those dollars to help the shelter system get through this current crisis. In terms of your question about the longevity of how long this will last, it is important to note that the city of Cincinnati will also be receiving an allocation of these emergency solutions grant dollars in particular, and our hope is that those are also going to be made available to extend how much time the operators could continue to do what they're currently doing if that proves necessary.
One second. So I want to pick up on 2 things, kind of follow up on what Kevin said. So we have reached out to the agencies that are providing services for the homeless population in Hamilton County. Joy Pearson was mentioned earlier, and I want to mention her again because she has, for the last couple of weeks, been calling all these agencies to get a better understanding of the population in those agencies and the need to remove a certain amount of people to appropriately distance those that remain and those that are moving somewhere else. And so the number is about 330. That's how many rooms we need, that those have been identified. And so the 1.1 million buys us enough 45 nights at hotel rooms for 330, either families or individuals, that need to be moved. And so it's a math equation, and we've done the math, and in conjunction with strategies and the county and the city, we're all working to try to figure out, if that number moves, then we need to move. But right now, that's the number. The second question was about where. I, too, have talked to some of the providers, and one of the reasons they gave for not telling us where they're moving people is because some of the individuals that are being moved are victims of domestic violence. The last thing we want to do is provide that information because that would be unsafe. And so we're not going to do that. Kevin punted. I'm also punting because it is just not the right information to put out into the community. So that's the reason you heard, although the idea that everybody needs this kitchenette capacity is a very important thing to note. So that's what we're working on. Thank you.
We have a follow-up from James Pilcher for you, Commissioner.
Commissioner, thanks. Can you tell me which rec center is being used and which one might be opened? Do you know that? Or Kevin, do you know that? And do you have any, and there's one more follow-up, do you have any more possible, so if this goes on longer than the 45 days or the population increases, do you have access to more money if you need it?
Let me take the first one first. So the OTR Community Center is the one that is being utilized right now for, and as Kevin said, these are folks that have symptoms. We do not yet know if they are carrying COVID-19 or if they're going to test positive, correct? So no one has been identified yet as a positive COVID-19 patient. What is the other rec center, Kevin? Beyond OTR? Okay. So the city, I used to be the president of the Cincinnati Recreation Commission. I proudly say that. I loved it. There are many rec centers. I think there are 28 right now throughout the city of Cincinnati. And so they're closed. They're all closed. And so there is some capacity there, and many of them have fairly large multi-purpose rooms, and I'm quite sure that's what's being used for the quarantine. And so there is some capacity there. Now there's a dollar amount associated that when you open up a rec center. Just think of utilities, staff, all the things that go along with that. And so I think the city's being prudent in opening them as needed, but it's nice to know that there's capacity. Your second question was relative to funding. If we find out that we have more individuals that need to be rehoused, or if we need to go longer. And so we referred to the federal dollars. It's like these stimulus dollars that are coming down. We as a county are going to receive some of those dollars. We're trying to get clarity from the federal government as to what those dollars can be used for. We feel very confident that this is one of the things those dollars can be used for. And so, it's a matter, those dollars aren't coming yet. And so we're in a position to kind of say, all right, can we front the money, or can we use dollars that are still coming for a purpose that we need right now? And so that's the situation we're in. And so as we look at rehousing, we're trying to be as careful as possible with that number, not overshoot it, because we don't have the money in our hands right now. But we're trying also to respond to what we know is an emergency situation. And so that's what you see. It's this tug and pull. But I am confident that we will have resources available to us through the federal government to either add to those numbers or to extend the amount of time.
Thank you. Next up is Scott Wortman. He has a couple questions for you, Mr. Finn, from the Inquirer.
Hi, good afternoon. Wanted to clarify, and I think Denise just might have answered this, to get an idea of the scope of this program. Is the total number of rooms 330, or is that just what the county's portion of the money is paying for? What is the total number of rooms that, did you mention other funding sources? What are the total number of rooms that and individuals being helped by this?
That is the total number of rooms, that 330. I think it's important to note that this is still a little bit of a work in progress. For example, when the family shelters first emptied out their congregate facilities into hotel motel rooms, they were not taking any additional families that needed to get into shelter. They have now sort of stabilized their operations sufficiently that they are, in fact, periodically adding some rooms for additional families that need to come into shelter, and they're having people exit their programs as they normally would, and returning to housing and no longer needing to stay in hotel rooms. So it is a number that changes at least modestly from day to day, but that is the total. I think the county is to be commended for making this funding available quickly, just as the United Way and Greater Cincinnati Foundation made dollars available very quickly. The county is doing the same. If this goes on longer, I mentioned that the city of Cincinnati would also be receiving an allocation of the Emergency Solutions Grant dollars. So if we get to the point where we have gone through what the county has managed to put forward, the next option would be to then perhaps tap into that city funding. I think Commissioner Dreihaus was absolutely right, though. We're trying to be as prudent as we can with these dollars, because something as a sort of a sidebar related to what this Emergency Solutions Grant funding is. It is a source of federal funding that can pay for shelter operations, but it can also pay to move homeless people back into their own apartments. So every dollar that we spend getting through the crisis and for paying for hotel and motel rooms is a dollar we wouldn't have 3 or 4 months from now to pay to actually move someone into an apartment where they're on the lease and the apartment's in their name. So it is in our best interest to be as conservative with these dollars as we can, to be mindful of the expenses that we're incurring preparing for the crisis, because whatever amount of this funding, whether it be from the county's allocation or from the city's allocation, whatever's left once the crisis has passed are dollars that we can use to do what our ultimate goal is, which is to get homeless people back into their own housing.
In the follow-up on the testing, how many people in your system have been tested, and how hard is it to get tests completed on people showing symptoms?
I apologize, I cannot answer the question about how many people have been tested. We have a great organization in town called the Cincinnati Health Network. They oversee the health care for the homeless program, and they actually have clinics physically located in many of the congregate shelters, particularly the single shelters, which are the ones that are still open and operating. So the Cincinnati Health Network would really be the organization that would need to answer that question for you. They have been a great partner in terms of being prepared on the healthcare side, specifically for homeless people.
I did have a follow-up question for Denise, if I may. I apologize. It was a bit of a delay on my video here. So do you know how much you're expecting from the federal stimulus?
Yeah, so it's a large amount. The challenge for us is trying to understand what we can use it for. So it's, it's over $100 million. And we're trying to figure out what we can use it for. This is obviously one of the things we feel very confident that we can use that for. And the dollars won't be available until later in the month. So we're trying to, that sounds like a lot, and so we're trying to make sure that that number is accurate for one thing. But if we have those kinds of resources, and I've already started to do this, we need to do some homework to try to figure out where those dollars would be best used, and then understand the flexibility of the dollars. So we have been talking to, and I think I mentioned this before, Senator Brown's office and Senator Portman's office, because the last thing we want to do is apply dollars to something that becomes ineligible for those dollars. And so we're trying to be very deliberate and very careful about how we approach this equation of where those dollars are best used.
Thank you.
I have a follow-up from John London with WLWT for you.
Okay.
Hi, Denise. This has had me scratching my head for some time, but so I'm going to ask it since, we'll probably get more than one wave. Carryouts, no longer have restroom availability, a lot of them, and this will be a recurring virus situation. Does this health emergency point up the need for numerous public sanitation stations and or self-cleaning restrooms that are staffed at least through the day? Isn't that a basic human need that government has overlooked?
I think I heard you say, talking about public restrooms or restrooms in restaurants. So, John, I think we're going to learn as we move through this pandemic about what needs to change and what is fine as is. I think that's on all levels, and I think I think it should be broadly understood that there are lessons to be learned here. I don't feel like I'm prepared to comment about how we're going to deal with sanitation moving forward, although I do think there is a need to respond to what we know right now. And by the way, I do want to remind everyone, and the health commissioner has said this more than once, so hand sanitizer is effective and it works and people should be using it. Washing your hands is better. So remember to wash your hands. And so, yeah, I think these are learning moments. And John, I think we all need to study what we're learning and have some real takeaways. I think Kevin would like to respond to this as well, so I'm going to leave the podium.
John, I think there's a fine line to be walked regarding when you start talking about sanitation stations and things like that. I would agree with you that offering those sorts of options right now in this time of the COVID-19 epidemic is a critical service for us to be considering. I think it is important to note, though, that in many communities around the country, there is not enough shelter capacity for people to go inside, and therefore people will be on the street. Nationally, 34% of homeless people are sleeping outside on the street. And in communities where people could not get into a shelter, even if they wanted to, I think it's very important to be considering things like shower facilities and sanitation facilities and different things like that. The reality here in Hamilton County, though, is to a very large extent, especially for single individuals, which is who happens to be on the street, we do have adequate shelter capacity. Shelter House does an unbelievable job of expanding to meet the need. And we all, in a normal time, we have to walk a fine line between doing things that would encourage or enable people to stay on the street when most of them could come into shelter. So that is more of a comment on the normal reality, which is obviously not what we're operating in right now. I do think it would be good to be looking at things like sanitation stations and that during this time of the epidemic. But in my mind, that is not a long-term solution because homeless people are 3 times as likely to die sleeping on the street as they are if they're sleeping in one of our shelters. So we do not want to do things that would, in normal times, inadvertently encourage people to stay on the street or enable them to stay on the street when the best thing for them, for their safety and to connect them with services that will get them out of homelessness, is to get them to come into a shelter.
Thank you. Next up, we have Jay Hanselman with a follow-up question for you, Mr. Finn. Jay, are you on mute? We seem to have lost Jay.
Let's try that now. How about now? The question I was asking was how long the 1.1 million would last. Part of that, I guess, would depend on the hotel motels. Are they charging the posted rate? Are they giving you a cut rate, or is there a flat rate if you're participating in the program?
As Commissioner Dreihaus mentioned, we've done the math, and 45 days is sort of what we're targeting at this point. Unclear where that will get us in terms of the pandemic. The reality is that each of the shelter operators had to go out and make their own arrangements very quickly in terms of accessing hotel and motel rooms. So it is not a uniform cost specifically because they all sort of in crisis mode had to go out and make their own arrangements. Plus, for families, you have to look at the possibility of larger rooms than you do, more so than you do for single individuals that are going into hotel and motel rooms. I'm sorry, was there a second part to your?
No, that was it. And then I did have a follow-up for Commissioner Dreihaus.
Hey, Jay, let me expand on that just a little bit, because I think Kevin pointed out a really important dynamic here, which is that correct me if I'm wrong, Kevin, the shelters already have moved people. Right. So they've already moved people out of their facilities to create this safe distancing. So they saw a need, an emergent need, and they responded to it. What we are doing is saying we know that what they have done for a certain period of time is not long enough. And so that's where we have come in and said, all right, we know that you only have capacity for, say, 15 or 30 days. With the extended stay-at-home order, they need more dollars to expand the capacity. And so that's what we're doing here. Again, I want to mention, and Kevin has said it more than once, that this is a collaborative effort between all of those agencies, the United Way, the Greater Cincinnati Foundation, the City of Cincinnati, Hamilton County, with Strategies taking the lead to try to coordinate, as they always do, right? Strategies is the organization that coordinates those providers so that we don't have such a hodgepodge. But in this particular situation, these providers saw that they needed to get folks out to distance, and they did it. And I applaud them for doing it, but now we are stepping in to say, we know you don't have the capacity to keep doing it, so that's what we're talking about here today. Sorry, so I know there was a question beyond that.
I just wanted you to clarify, you mentioned the $100 million in federal money. Is that for the county alone? I was unclear on that. Or is
Well,
that for the
remember
state?
that they talked about any government entity over 500,000 can receive those dollars. You have to be a certain size. Hamilton County is about 800,000, and so we qualify. And so we are talking to our friends in Cuyahoga, Franklin, and obviously Hamilton counties. We are the biggest, and try to figure out, I think we're all really concerned about our understanding of how those dollars can be used. And so they don't come until the end of the month, so we've got a little bit of time, but as you can see, some of the needs are right now. And so we're trying to kind of understand the balance here and be as reactive as we can in an emergency, but also be prudent with the resources. So that's what you see going on.
Thank you.
So it appears we have one last question. This question is for you, Mr. Finn. It's from James Pilcher with Local 12.
Hi, I know we talked, you have the organizations that are already in your network. I want to ask specifically about Maslow's Army and Shelter House. Are they going to be able to use this money to continue to put people up in Florence? Or are they going to have to move them back over to Hamilton County? What's the protocol for organizations that may not have been subsidized by your organization or by public dollars in the past?
First, before I answer your question, I want to add to the list of organizations that Commissioner Dreihaus just named. The Greater Cincinnati Homeless Coalition has also been a huge partner in making this all happen. So I just wanted to make sure that we acknowledge that Josh Spring in particular has done a lot of work to help make this plan and implementation of this plan happen as well. Actually, Shelter House is one of the largest recipients of these federal government dollars on a regular basis. So again, we're sort of using existing structures to get these dollars out quickly. So the county does receive an annual allocation of these dollars separate from anything related to COVID-19. We do allocate and distribute those dollars on behalf of the county when we're talking about even just the normal annual allocation, and we're going to perform that same function on behalf of the county related to these new stimulus dollars. Shelter House in particular does already receive those dollars from the annual allocation, so there is no question that Shelter House would continue to receive these dollars to provide the essential services that they do provide. Maslow's Army is in a slightly different situation given that they operate on both sides of the river and because they have not previously received these dollars. We've been doing a lot of work with Maslow's Army to make sure that they are documenting who they are serving and where they are from, so that we would know of the people that they are serving, who was from Hamilton County, that sort of thing, and could attempt to tie back, what would be an appropriate level of support for Maslow's Army based on the number of Hamilton County residents that they were serving. Not that they wouldn't receive support for non-Hamilton County residents, but, the counties in northern Kentucky and that are receiving allocations of these dollars as well, so it would be appropriate for them to provide support when we're talking about Maslow's Army providing shelter to people who are northern Kentucky residents, just by way of example.
Seems to conclude our questions from reporters.
Okay, thank you. And I thank you for mentioning Josh Spring. Josh just sent me a letter. I'm sorry, Josh. I should have said that the Homeless Coalition obviously is a partner in this. And we received a letter about this very issue over the weekend with many co-signers to say that this is something that we need to take a serious look at and respond to, and I think that's exactly what we're trying to do here. So thank you to the Homeless Coalition and all the other partners for getting us to this point, and I know we will have continued conversations with all of the above as we move through this. So, remember we're going to a Monday, Wednesday, Friday schedule this week for the briefings. They're not daily briefings. And so we are going to just to let you know, we're going to talk a little bit about small businesses and what the situation is there, what relief exists there for all those small businesses and their employees that are not drawing a paycheck right now. So not sure if that's going to be Wednesday or Friday, but we are working on trying to bring in some of the most appropriate people to talk about that dynamic, something that a lot of folks are very concerned about and are living here on a daily basis. So I want to thank Kevin Finn, and I want to thank Nick. We haven't forgotten about Nick. DiNardo back here in the corner. Thank you so much for being here. I think these are conversations that we need to continue, and I can continue to provide updates as we move through this, but it's like everything else. It's a very fluid situation. So as you have questions or comments, please reach out, let us know, and we'll try to provide as much information as you can. I want to go back to what the top line thing we talked about right when we started here, which was this dramatic increase in positive cases in Hamilton County. We've been talking about this exponential growth of cases that we expect to see during the surge. This is part of that, and I want to say, and I will bring you a graphic. I've seen it that has, here we are, and there we go, right? And this is where we're going. We're on the up curve right now, so it is so important that we continue to do what we know we need to do to prevent the skyrocket in this curve. And we've been doing it. We've been washing our hands. We've been staying at home. We've been staying away from people when we're out. There are some things that have been happening, and I've received some reports about what's going on in, say, a grocery store or something like that, and people were concerned. I do want to say that we all bear the responsibility to do this well, and so, when you walk into a grocery store or a convenience store or whatever it is to get some essential products, it is on you to prevent distance, or to prevent being close to one another. While Kroger and Home Depot and other retailers are providing the decals to keep people from a certain distance from one another, and I applaud that because it's a reminder that, we need to stay. It's on every single one of us to do that. You have to, when you're walking down the street, distance from one another. When you can see us in this room, Jay and I, as I pointed out on Friday, are 6 feet apart from one another. It's on all of us to respond to what we know we need to do. And so it's working. Dr. Acton has said, we are starting to see a little bit of a flattening in this curve. We have bought a little bit of time to get the PPE we need in this community right now, and we need it, and we don't have enough, and we're working on it. But everything we're doing every day is helping with all of the above. And so I want to thank people for taking this seriously in this community, and remind people that it's really on all of us individually to make sure that we're doing everything we can to flatten the curve. So thank you all, and we'll be back on Wednesday.